If you've ever wondered what ED or erectile dysfunction is and how it's treated, I hope I can give you the answers. Hello, I'm Dr. Christopher Love, urologist in Melbourne, Australia. Erectile dysfunction is the condition where men cannot get or keep an erection for long enough to have satisfactory sex. Very common in our community, and it gets more common as men get older, and there are many causes for it. It's often associated with other conditions such as heart disease, high blood pressure, high cholesterol, diabetes, and it's very common if men have had surgery in the pelvis, particularly surgery for prostate cancer. There can be psychological reasons for erectile dysfunction as well. We have a range of treatments we can offer for men with erectile dysfunction, starting from simple medication through to more complex medication, and for many men the best answer will be penile implant surgery. Oral medications for the treatment of erectile dysfunction have been around for over 20 years now, and most people have heard of the drug Viagra. Its real name is sildenafil. There are many other versions of these types of drugs available, and the drugs have become better in how well they work and are causing less side effects than some of the original drugs. About 50 to 60% of men will get a satisfactory outcome from using these types of tablets, but one of the major complaints is the lack of spontaneity. With erection drugs, you generally need to take them minimum 30 minutes and possibly up to 60 minutes before you have sexual activity. And for many men, they find that pre-planning is not really satisfactory for them. One of the newer drugs has a shorter onset of action, possibly only 15 minutes, and that's a huge advantage. And one of the other ways these drugs are being used is to use a regular daily low-dose medication taken every day, which gives the ability to have sex spontaneously at any time. So we generally try and tailor a solution that suits what the patient wants and what the frequency of sexual activity will be. When oral medications don't work, or if there is any sort of contraindication to using them, we have got some other options that patients can try. Another common treatment is the use of injections that are given into the shaft of the penis by the patient themselves. Whilst that sounds fairly awful, most men find they can do it without problem, and these drugs cause an erection. They tend to be stronger than oral medication, so they're more likely to work even if the underlying problem is more severe. And for many men, it's a very satisfactory answer. There are some problems with injections in terms of a little bit of discomfort, risk of bruising and bleeding, and sometimes scar tissue can develop in the penis. Another non-invasive treatment that some men use to enable them to have an erection is the use of a vacuum erection device. This is a device that's put over the penis, suction is applied which draws the penis up into an erection, and then the erection is maintained by a soft rubber ring that goes around the base of the penis after the vacuum device is removed. A lot of patients can manage to get a good quality erection, although many patients find it a bit cumbersome and time consuming, and they don't spend the time to really learn how to use the device correctly. The ultimate way, and I think the gold standard way of treating erectile dysfunction, particularly because of the spontaneity of sexual activity, is a penile implant procedure. We're able to put a device surgically inside the penis at a short operation with just 1 day stay in hospital, and that device really enables the man to have an erection whenever he wishes. It's essentially like putting inner tubes inside a flat car tyre. We have cylinders inside the penis, we have a reservoir inside the body near the bladder, and we have a little pump that sits in the scrotum. The patient's able to press on the pump in the scrotum, transfer the fluid from the reservoir through to the cylinders inside the penis, and those cylinders fill up with fluid just the same way the penis would normally fill up with blood. A man can achieve an erection in less than 30 seconds and can have an erection that lasts for as long as he wishes. For many men where the simpler treatments don't work, this is a really good alternative for them to consider. I hope this information has been useful and has given you some understanding of erectile dysfunction and at least an introduction into how we can treat it. In further episodes of Below the Belt, I'll be providing more information, particularly on penile implants, and talking about the real benefits and what it's like to live with a penile implant. I'd love it if you'd keep watching our series, and I hope we can give you more information to come.